Hello, so this is everything you need to know about sex drive. Every person has their own sex drive that is normal to them. A number of factors may cause it to increase and decrease. So, first definition. Sex drive or libido refers to a person's desire to engage in sexual activity. A low libido refers to a decreased desire relating to sex, while a high libido is an increase in desire for sex. So, what are the causes for a higher sex drive? Some reasons that a person may have a higher sex drive include exercising. One study suggests that people who engage in physical activity tend to have higher sex drives. Drug taking. Stimulant drugs such as cocaine can cause an increase in libido. Changes in neurotransmitter. Dopamine is a neurotransmitter. People with Parkinson's disease may receive dopamine replacement therapy. This can cause hypersexuality and sexual compulsion. Testosterone. Some older research suggests there may be a link between higher testosterone levels in men and higher sex drives. So what are the causes of lower sex drive? There are many reasons a person could have a lower sex drive, including menopause. Studies actually looking at female libido highlight that during menopause, sexual hormones decrease. Culture and religion. People who are subject to highly restrictive religious or cultural beliefs may have lower levels of sexual desire. Mental health. Studies have found that males and females with mental health conditions such as anxiety or depression may have a higher risk of sexual dysfunction. This can lead to a decrease in sex drive. Age. Sex drive may fluctuate as a person ages. So one source highlights that once people reach the age of 60, there is a decrease in libido. Obesity. There is some research to suggest that a link exists between obesity and sexual dysfunction, which may lead to a lower sex drive. Chronic conditions such as diabetes, heart disease, nerve damage paired with psychological effects such as self-image and tiredness can decrease libido. Pregnancy. One study found that women tended to reduce their sexual activity during pregnancy. Relationship satisfaction. One study found that the libido of some females may decrease depending on their satisfaction with the relationship. Medication. Medicines or treatments may cause decrease in a person's sex drive. Some of these include chemotherapy, female hormonal contraceptive, and antidepressants. So, with all those things that can lower your sex drive, how can you increase your sex drive? Some people can try following methods. So, one method is sex therapy. A sex therapist can assist with sexual problems. While they can help increase sex drive, they can also support people to achieve orgasm. Increased sleep. A study found that longer sleep durations in females led to a higher level of next day sexual desire. Aphrodisiacs. So herbal aphrodisiacs such as yohimbine and Eurycoma longifolia may help to increase male sex drive. And certain foods such as strawberries, chocolates, raw oysters can also have an aphrodisiac properties. Exercise. People may increase their libido through mindfulness and yoga. And then we also have testosterone therapy, which in older males has shown it could help them regain some sexual desire. So we've talked about what a high sex drive looks like, what a low sex drive looks like, and how you can increase it. But we didn't really talk about what is a normal sex drive. It is best to view sex drive as a spectrum. What someone may consider normal may be different for another person. Sex drive can also fluctuate, leading to a higher or lower libido. In some cases, a person's sex drive may become extremely high or extremely low. This may develop into sexual functioning disorder, which can include a lot of different things. So, summary. Sex drive is on a spectrum, and what may be normal for one person may not be normal for another. There are many reasons why a person may have a high or low sex drive, or why it may fluctuate. Medication, age, chronic conditions can all affect it. There are ways to increase libido, which include exercise, sex therapy, or getting enough sleep. If a person is worried about any changes in their libido, they should discuss this with their doctor. So, thank you for listening.